All right, Penny. I've done 500 episodes, and this is the interview that I personally have been most excited about.
Thank you.
Thank you so much. Thank you so much for coming. A long ways, by the way. You know, your content helped me during a very challenging experience in my life. The first time I have ever been present with someone who I love and care for, who was a mentor to me, as he was dying from cancer. I didn't know what I was going into. It felt awkward. And I made the choice to go and sit with him for hours and hours and hours, multiple times a week. And your content, I found it somehow, and this has just been, less than a year ago. And the stuff that you were posting, because of the humor you put into it, the realness you put into it, and it's informational too. It made me feel a lot more comfortable doing what I was doing, and it really took a lot of pressure that I was putting on myself to show up in some sort of way like I was going to make this better. It took a lot of pressure off, and it had a tremendous impact on me. I want to thank you for that.
Oh, thank you for saying that. You're going to make me cry right out of the gate here. I mean, I appreciate that feedback so much, and that's, one of the things about being on social media that just really, makes me feel so much, gratitude for the platform, first of all, but it just makes me feel so good to know that I'm helping people, and that my content, which is not for everybody, but resonates with a lot of people and helps them through a difficult time.
Mm-hmm.
I always look at death like it's a dark topic, and I like to lighten it up. And it's a scary topic, but it's real, and it happens to all of us in the end. And not talking about it isn't going to stop it from happening, but it will cause people to have a lot more fear and anxiety if they don't know what to expect when their person or someone who they love is dying.
Mm-hmm. That's amazing. And we're going to get into, I have so many questions for you today. And I want to ask you first, I do think that this needs to be addressed, because people from your audience is going to see this interview. People from my audience is going to see this interview, and we are a lot different in a lot of ways. We have different beliefs. We have different perspectives on things. We're different in a lot of ways. As I get older, I'm beginning to learn that I can learn from people who are different than me, and I can actually be helped by people who are different from me. And that's one of the reasons that I love your content, even your content apart from the death and dying and your experience as a hospice. You're so passionate. You're so fired up about what you believe in. You're a lot like me, right? You're a lot like me. I guess I want to tell everyone listening, whether you know me or you're just seeing me for the first time, or you know Penny, or you're just seeing Penny for the first time, as you dig into who we are, understand that we do have differences, but understand that Penny has helped me in a lot of ways through the content that she posts. And I'm going through a process of tearing down these labels that I have bought into for so long. And I'm more willing to admit right now at this point in my life that I've been wrong about a lot of things. And it's a beautiful process that the Lord's taking me through right now, just continuing to reform me and make me think about things. And I wanted to ask you, why did you decide to come and do this show? Because this was a big commitment for you. You're coming in here with someone who's you've never met before, who's different in a lot of ways, it's a long ways to travel. Why have you given me this opportunity? I just wanted to hear that from you.
Well, I saw you on the Joe Rogan podcast, and I reached out to you afterwards and said thank you.
Even though I called you crazy.
For calling me out, even though you called me crazy. And your response was that you love that about me. And it was kind of like what you're saying, one of those things where we're very different. And I knew that. But when you said that, it was kind of like, okay, well, this guy, he's pretty cool. You know, like I in our chats we've had with each other through Instagram, not a lot of them, but a few, I've really felt like you are somebody who's like really open-minded, and I appreciate that about people, willing to learn, willing to grow. I love that about people. I think, you know, the ability to recognize when and acknowledge when we might be wrong about something is what helps us to become better people. I've been through a lot in my life, a lot of bad things that have happened to me or that I have brought on myself, and I've learned and grown from all those experiences. And I just think having the willingness to explore different thoughts about things is a gift. And so I was just kind of really interested to hear what you had to say. And people were asking me, well, what are you going to talk about? And I said, I don't know. Like, what's the concept? My sister said, what's the concept? What are the questions? I said, I don't know. I think we're going to talk about, you know, afterlife, and that we have very different views. That's the other thing that you said on Joe Rogan was that I'm not a believer, and yet I have this perspective about afterlife that I think intrigued you. So
and I've gotten more insight into that from the book. And we're going to get into that for sure. But yeah, I'm drawn. I'm sick of having one-sided conversations. Like, one-sided conversations are good every now and then because you can go deep on one side if the other person agrees with everything that you say. But I'm really drawn to deliberating, not debating, but deliberating.
Yeah.
And to deliberate anything, you have to, one, be willing to admit when you're wrong on things, right? And that, I believe that's how we are going to get as close as we can possibly get to the truth. And we need unity in our nation right now. Like, not just our nation, but we need unity as humanity.
Yes.
And that's going to come through deliberation, I think, and not debate. Not two people sitting down who are convinced and concerned only with the fact that they are right, but two people sitting down and saying, hey, we think differently. Let's talk, and let's be willing to admit when we're wrong in order to get a little closer to the truth.
Yeah, I love that about you. That's why I wanted to come on here.
Amazing. And I do have to mention before we get into the for the listeners, we're going to get into Penny's story, what led her to this position as a hospice nurse, and we're going to talk about the impacts that it's had on you. A lot of the impacts it's had on you that you mentioned here in the book, impacts like forgiveness, joy, purpose, meaning, those seem like strange impacts that, like, you don't you more think if you're spending a career with people who are going through this really, really difficult time, might cause depression or anxiety or fear, or it had the opposite effect on you. So I want to pick that apart. We're going to get into the woo-woo stuff a little bit, as you say in your book.
Woo-woo stuff.
And I'm super pumped about that because, you know, that was some of the content I was watching when I was, you know, with my friend Dawn, seeing some strange stuff that I didn't know what was going on. And you're not afraid to talk about those things. We're going to talk a little bit about the afterlife. And there's a part in the book where you talk about very early on in your career with the nuns and the eyes being a window to the soul. And I'm very intrigued by that. And so that's where we're going, if you're listening. The book, Influencing Death, this is Penny's book. And I didn't read the whole thing because I still wanted to be curious about your story as we did the interview, but I have read a good bit of it, and it is so well written. And what I mean when I say that is that it reads easily. I mean, you will get into this book and you won't want to put it down because it's like you're having a conversation with Penny. And I commend you on that because that's hard to do. I mean, you are a writer.
Thank you.
It was very, very impressive. So you need to talk about this book more, by the way, because I didn't even know it existed.
I do. You know how social media works. Some videos go out places and some don't. And I have people that are like, you wrote a book? Yeah, actually I did. It came out a year ago. And I put out tons of videos about it, but not everything gets seen. So.
It is really, really good.
Thank you.
Yes. So I guess we should first, before we get into the meat of it, I guess we should first just define what is hospice. I've also heard you use the word palliative care. Are those the same thing? What is it? How do you define it?
Yeah, so palliative care and hospice are different. They kind of hold hands in healthcare. Palliative care is for people with a terminal condition with any life expectancy or a life-limiting condition, and they're still seeking treatment for whatever their condition is, but they are needing some extra support, whether it's social support or usually it's going to be symptom management. So somebody on palliative care might have cancer, but they're still getting treatment for their cancer, and so they're having symptoms that they need managed. So palliative care is really good about managing symptoms outside of just regular health care, a little more liberal usually with pain medication. But also like whole person care. So they're looking at the whole person. They're not just an oncologist who's looking at the cancer or a cardiac specialist who's looking at the heart. They're kind of putting the whole thing together and looking at it. Hospice is strictly end-of-life care. It is for people with a terminal condition with a life expectancy of 6 months or less and really focused on the end of life. Hospice usually takes place in the person's home or wherever they call home, whereas palliative care is usually done in the hospital or a clinic setting. Hospice care is also whole person care. We have a lot more team members. So there's going to be a nurse, a chaplain, a social worker, a hospice aide, physician, a whole interdisciplinary team that's managing the care of the person. And again, really focused on end-of-life care. And that means quality of life over quantity of life. So a person is no longer seeking treatment for their disease. They have to be done with chemo or radiation or whatever it is that they're doing to try to cure their disease. It's not curative at all.
At what point, is there like a point that's clear when it's time for hospice to come in, and like, how is that judged?
Yeah, it's not always really clear, and a lot of people think it's for the end of life, and so we get a lot of people who refer to us very late. It is, again, for a life expectancy of 6 months or less. Part of the problem is people don't really want to talk about death, and that includes physicians. Oncologists are trained to cure the cancer. And in general medicine, just overall, death is thought of as a failure. If your patient dies, you have just failed them. They don't learn in med school how to address death as much as they learn how to cure people and how to treat their disease and make them better again. It's all about wellness. So conversations don't happen when they need to happen. So oftentimes a person is ready for hospice, but nobody wants to talk about it and say, this is where we need to head with this. Because, another thing is that people think that hospice means a person, or that hospice is going to cause a person to die faster. And that's absolutely false. We do nothing to hasten death. We don't prolong life, nor do we hasten death. We allow death to occur naturally whenever it's going to occur. We don't give them drugs to make it happen faster. We don't starve people to death. We just allow their body to dictate when the end of their life is going to happen. But again, because of this reticence to refer people to hospice, because of that thought that they're going to die faster if they go on hospice. They come to us late, then they die really fast. And then again, that sets up this idea that you go on hospice and you die right away.
Yep.
It's like a vicious cycle.
You talk about in the book, there's this like point that people get to in the dying process where they're more dead than they are alive. So you want to get to them, like it's time before they turn that corner when they're more dead than they are alive. Like you want to be treating them prior to them hitting that point, right?
Yes. Yeah, that's transition.
Yep.
That's how I describe transition, because there are stages to dying. We're all living more than we are dying, but we're all dying. That's what getting old is. Some of us are closer than others, like me. But then when a person is dying, there comes a point when they're more dying than they are living. Yep. And that's that transition. And yeah, we want people before that, because sometimes transitioning can happen very quickly. And we're, in a scramble trying to teach the family what's going on, how to help them. And my favorite thing about educating about the end of life is normalizing the process, because I've noticed when people are unsure about what they're seeing a dying person that's doing, like you said, you saw things with your friend that was dying.
It's brutal, Penny, when you've seen it for the first time.
Yeah, and you don't know like that's normal. You don't know those breathing changes are normal. It's terrifying. But if you know that's normal, it's so much easier to be with that person, which is a very sacred experience, to be able to walk along the side of somebody when they're dying. And I've been with so many families where they were freaking out over what they saw, and I would say, that's normal. And their relief was palpable. They were like, oh, that's normal? Yeah, that's normal. We see that all the time. You just want to know that it's normal, And so when they come to us and they're already transitioning, there's so much we have to teach about what to expect, and also how to care for that person, because most hospice patients are cared for by their family members, unless they're in a facility. Usually it's family that's taking care of them. So we are teaching how to do oral care to keep their mouth from drying out, how to reposition them, how to deal with those terminal secretions or that death rattle, which is terrifying to so many people.
Another thing on this subject before we switch gears is you also describe the difference between natural death and unnatural death, and what you guys are able to provide as hospice nurse is the opportunity to make the choice to die a natural death. And explain a little difference between those two, because some of us at the end of our lives, we may have the opportunity to make that choice. Do we want to die a natural death, or do we want to be hooked up to machines? We won't all have that choice, but some of us may have that choice. And
Yeah, an unnatural death, the way that I define it, is somebody who's usually going to be in the hospital. They're on machines. They're getting their vitals monitored. They have an IV drip going. They might be intubated. They have all kinds of medical interventions going on, whereas a natural death, we are allowing a person just to die without any of that extra medical intervention. We still give medications and do things with people to make them comfortable, but we're not going to try to do anything to prolong their life.
Yep. And it is it is a sacred thing. It truly is. Like, after going through that experience with my friend Dawn, it was so sacred and so impactful that it made me regret not being there with my grandfather when he went through the process. Like, man, from a very selfish perspective, I'm thinking I really missed out on that experience with him, that sacred experience. And I want to have the courage to seize the opportunities to be with my family members who are older than me, if I'm still alive when they go through that process, because you are right, it is a very sacred thing. I do want to address the fear around it, because many people may be tuning into this show And initially they may be thinking, why on earth do I want to hear conversation around death? It does seem like the majority of people who are mostly alive, like we're still in that stage where we're more alive, it seems that the majority of people are fearful of death. And is that normal? Like,
It's, it's,
or is it because of our culture?
It's because of our culture.
Okay.
Yeah, we've made it a taboo topic. Back in the old days, before medical interventions could prolong life like it does now, or like they do now, people died in their home. It was just a normal thing. Grandma would die in the bedroom down the hall, and the family would be there taking care of her. It was normal. They would have the wake in the house. It was just, everybody accepted death because that's what happens to all of us. And then something changed. We had advancements in our ability to prolong life, to cure disease, to keep people living longer. And people started going into the hospital, and they would die in the hospital. And so we weren't exposed to death. Again, death is seen as a failure by the physicians, so they didn't talk about what's happening. All of a sudden, people are going in the hospital, they die. That's, we don't talk about it anymore, and it becomes, something that we have more fear around. And then hospice came in, around the 70s or so, and they started being like, oh, we don't want people to die in the hospital because it looks bad when we have a lot of deaths in our statistics. So let's try to get them out of the hospital and get them home. So that's why hospice kind of came along. But because we just shoved everybody in the hospital and stopped talking about death, it just became something taboo to talk about.
I even think about it too, Penny. I'm sure you've thought about this too, how even not too long ago, when we were harvesting our own food, when we were raising our own cattle, or we were eating from our, own flock of chickens, like, even that, we're so connected from even that. Like death, it has been shoved out of every aspect of our life. Whereas not too long ago, it would have been intertwined with our literal survival.
Yeah.
And so not only eating and harvesting meat and food and, animal products, we would have been exposed to that on a pretty much a daily basis. And that's some pretty graphic stuff to be exposed to,
That's a really great point too, Chad, and one of the things I talk about is that we should be educating children about death, because we can set up fear in children by not letting them go to the funeral, or telling them that their relative went to sleep and they're never going to wake up. And one of the things that you can do to help acclimate children to death and dying is through pointing out, death of things around them, whether it's their own pet or roadkill or a fly that died, to be able to say that fly is dead. It's not going to fly around anymore. It's not going to eat. It's not asleep. It's just dead now. And that's a really great point that we used to, we, not me, because that was even further back than I've lived, but my mom would like butcher chickens on the farm. Mm-hmm. It was normal for them. And so they were exposed to death more. So yeah, I think that's something else that does lend to, this idea that we just can't talk about death, or we're not exposed to death anymore.
Yep. Have you noticed with your patients throughout the years, how many patients, roundabout number, do you think you've?
And over 1,000.
Over 1,000.
Yeah,
wow.
I started off working in hospice care centers, and that is a facility where people who need a higher level of care, they can't be in their home anymore because they have symptoms that need to be managed. So they go into a hospice care center on a higher level of care so that we can manage their symptoms, with the idea that they're going to go back home. But typically people that, especially if they have cancer, have an increase of symptoms are usually closer to the end of life, so they would die in the care center. So for 7 years, I worked in a hospice care center where I always call it at the bedside, in your face, death and dying. So like lots of patients dying around me. And then I did case management for home hospice too. So yeah, over 1,000.
Wow. And Mr. Don went to one of the care centers at the very end too. Do you notice that fear, this is what we're talking about, that fear that most of us are experiencing due to the culture that we've created, does that fear remain for the majority of people when death becomes a reality to them? Like they're facing it down. Or is it a mixed bag, or do people, is there some peace that we have when we are face to face with the fact that, okay, we're leaving this place?
Most people do get to that point. I've had patients who didn't. They're very anxious, especially if they're younger. And that can cause terminal agitation, where somebody is just so agitated and they're not coherent anymore. And then we usually have to medicate them heavily, sometimes sedate them until their death. But more people get to a place of acceptance before their death. And it's a beautiful thing when that happens. And one of the stories I tell in the book is about a woman who was on TikTok, and she had just been diagnosed with, she hadn't just been diagnosed with it. She had terminal colon cancer, but she had just been referred to hospice. So she made a TikTok talking about how she was terrified because she knew now for sure she's dying. And I mean, it went massively viral. She got like 10 million views, and she was crying and she was scared. And people kept tagging me in this video saying, "Hospice nurse Penny, can you help her? Can you help her?" And I responded by saying, "No, I can't, because she's just been told she's going to die for real, and she's afraid, and that's normal. She needs to feel those feelings and work through it." And pretty soon, her videos started to be more about checking off her bucket list. She wanted to try beignets. She had never had beignets before. Another person on TikTok fundraised. He was a beignet chef, and he fundraised to be able to go to where she was and make beignets for her. And they had a New Orleans style Mardi Gras with her and her friends. And it was just amazing to watch the transformation of somebody who was so afraid to somebody who had got to a place of acceptance and was really taking advantage of the last part of her life to do all the things that she really wanted to do.
Wow. What do you have any idea, like, where is that acceptance coming from? Is that a psychological transition? Is it like,
I don't know.
How do you explain that?
Yeah.
Because you're scared to death of it. A lot of people listening right now are scared to death of it, and they just say, there's no way when I have to face this down. I cannot ever imagine being able to experience peace about what I'm about to have to endure.
Yeah, I don't know where it comes from.
That's wild, isn't it?
Yeah, and it's the patient, not usually the family. It's usually the patient. Something that helps with that is being allowed to talk about it, and I think that's where hospice comes in, because we do have the social worker and the chaplain for people to be able to express how they're feeling and to work through that. A lot of times, family members don't want to talk to the patient because they're afraid that it's going to cause them to die faster by talking about it, which it's not, or that they'll give up hope and they'll die faster. And the patient doesn't want to talk to the family about it because they don't want to bum them out, and not like they're going to be more bummed out. They already are. But there is a disconnect sometimes, and they can't have that conversation. And really having those conversations does lead to that acceptance.
And it's going back to the point you made earlier, being able to normalize this experience is, that's like, there's going to be a lot of peace that comes from that. I know I have one example of being with a dying person, so I keep referencing that. I know, like, when I was with Mr. Don, he would talk to me. He had questions about what's about to happen, like, and of course I'm coming at it from the scriptures, and I'm, because that's my belief, and his too, by the way. And so I'm like, well, let me take it upon myself to study the scriptures, to see what the scriptures say about death and what this transition is going to be like. And I would go and read that. So we would have these conversations, like realistic conversations, like, okay, I'm dying. I have these questions, and I'm like, I know you're dying, and we're going to talk about this. And I could see it change, like it would change him. it was manifesting some thing in him, so it was powerful, man.
We're so lucky to have you with
Oh,
him
my
and
gosh.
willing to talk about it, because again, so many people are unwilling to talk about it. And it is something that just brings peace to people to know what's going to happen. I
Yeah.
had a patient who one time in the care center, she said to me, "Do you have any literature on dying?" And we had a little handbook. It's called Gone From My Sight by Barbara Carnes. She's a hospice RN since way back. And I brought her the little booklet. And later on, I went into the room and she had the book and she started tapping on the book and she goes, that's it. I'm going to die soon. And I said, how do you know that? And she said, because it talks about people seeing people that they have known who died. And I've been seeing my husband.
Wow.
And I was like, wow, that was really cool, that she really wanted to explore what was going to happen. Most people who are really at the end of their life, they have, you wonder, like, what are you afraid of? They're not afraid of the death part. They're not afraid of what's going to happen after they die. It's like almost like they're over it. And it doesn't matter what their spiritual beliefs are, what their religion is. It's like they're not even thinking about that. They worry about two things: what is going to happen to their family, and what is the dying part going to be like? Am I going to suffer? Will I be in pain? Will I linger? Those are the things that people are usually most afraid of at the end of their life.
Yeah, that makes total sense. Yep. We have to get into your story, at least, to some degree. You have been so open and honest and forthright about your story in the book. And thank you for that, by the way. That's your testimony. And it's like it takes a lot of courage, though. And I'm just wondering, I want to preface before we move into, the impacts that being a hospice nurse has had on you and the unique impacts that you mentioned in your book. I think we have to learn a little bit about your story before we can understand how those impacts have been made. So how do you get to the point where you choose this profession as your calling, the way that you're gonna serve your fellow man? Like, because it doesn't seem like a profession that most people would choose. So you go as far back as you want to go, but just kind of walk us up to that point where you said, okay, this is what I'm going to do, and this is why I'm going to do this.
Yeah, so it's layered. First of all, I didn't go to nursing school until I was 40, and I was going to nursing school because I was in the middle of getting divorced, and I needed to have a career. I had a rough, not adolescence, young adulthood. Got into drugs, went to jail, got pregnant when I was 20, married the dad, then divorced him right away, and really wanted to party and gave my son to his dad to raise. So I really was kind of a crappy person, you could say.
I've been there. Not exactly, but it's a crappy person part, yeah.
And then I went through treatment and cleaned my act up. Remarried, had a couple of daughters, and really settled into being a better person. When I decided to go to nursing school, I knew that I wanted to do something that I felt was service work. And all nursing is service work. We care for people. That's what we do. But to me, having had an experience with hospice when my husband's stepmother died a year before on hospice, I kind of felt like the work that they were doing was sacred. Like, I saw what they were doing, and I was like, wow, that's really something that I think is really important work. And it was either going to be that or working in a nursing home, because at that time there was a lot of abuse in nursing homes that was coming out in the news, and I just really wanted to make a difference. But the other part of it was that I had severe death anxiety, severe.
Yeah, you mentioned that in the book. Yeah.
Yeah, so I would cry at night, and my husband would be like, I'd say, what happens if there's nothing after we die? And he'd say, well, then it won't matter because you'll be dead. And I always joke,
Wrong answer, right?
That's why I left him,
Yeah.
you know, because he couldn't support me in my death anxiety. And by the way, I think my death anxiety was created when I was a child by my mom telling me that my grandfather had gone to sleep and was never going to wake up. That's what death was. So I had this fear around death. I wasn't raised with any religion. I had no concept of afterlife. And so I just had this real fear around death. And I thought, well, maybe if I'm working with dying people, somehow that will help me. And not only that, but it'll be kind of my retribution, if you will, to the life I led earlier. So 2 birds, 1 stone. And so I worked in a family practice. I became a licensed practical nurse first. And I thought you had to be a registered nurse to be a hospice nurse, which is not correct. So if you're an LPN or an LVN and you want to be a hospice nurse, you can be. Worked in a clinic for a year and then knew that I was going to go on and become a registered nurse at some point. But I worked in a hospital for a few months after the clinic because I wanted to start doing more patient care. And so I went to work in the hospital, and then they laid off the LPNs. They do that in hospitals. And there was a hospice care center opening up down the street from somebody I'd started dating. And I went in there and said, are you hiring? And they were. And I got my first job in hospice. And then from then on, that's pretty much all I wanted to do after that. I just knew that was something I could do.
That's a very courageous testimony or story, because you're basically running toward the thing that's kind of been haunting you. Reminds me of prolonged exposure. My wife, she suffered from OCD, and it's like, this has been the one. Yeah, this has been
That's me too.
The one
OCD, ADHD, I'm loaded.
The one thing that's helped her the most is running toward the things that she is most like just obsessed about, and just like immersing herself in that. And it's been amazing to watch, and it sounds like that's essentially what you did. But also, I see in the content that you post, your passion is coming from what I see in you as your greatest gift, and that is the fact that you care deeply for people. And I see your passion for current events, for things that are happening, for the destruction that's being caused. I mean, you get so fired up, and people need to understand. I needed to understand. Why is Penny so fired up about this? And it's like, oh, because she has a special gift, and her gift is, and you correct me if I'm wrong, but it seems it is, you care deeply for the well-being of people.
I do. And
yeah.
Part of that comes just from working in hospice and caring for people from all walks of life. You know, that's, everybody dies, and that means that I'm going to be caring for a lot of people who come from different backgrounds. I've cared for people who were basically homeless, and I've cared for rich people, and I've cared for religious people, and I've cared for atheists, and I've cared for black people and brown people and gay people, and so I've cared for so many different people, and really, it's a gift to be with so many people like that.
It is. When I look back on my military career, if I could say one thing, maybe the most important thing that I got from that was being around and having to learn to work with people of every color, of every background, of every religion. I mean, that was the most, for me, being a 19-year-old growing up in North Georgia, the culture in North Georgia, at least when I was growing up, was, there was still a lot of division. It's gotten better, in the South. It has gotten better. But when I was growing up, it was like we stayed to ourselves, and if you were different than us, you stayed to yourself. And then going into the Navy, similar to what you were talking about, having to work with all of these different patients, and you begin to realize, well, these people are humans just like me, and we can work together. We can be on a team together. We can do hard stuff together, and we can have a common goal and a common mission, and it was transformative for me.
And it enriches our lives so much to be able to be around other cultures. If you think about, like, I'm a foodie, so I think about all the different kinds of foods that I love to eat, Indian food, Thai food, Japanese food, Mexican food. We get all these other things from other cultures that enrich our lives and give us so many different perspectives and, ability to be more creative and thoughtful. And
yeah, that really resonates with me. So you run toward this thing that you've had anxiety around, and I want to get into now really breaking down the impacts that your career has made on you. Specifically, again, I'm reading in the book, forgiveness, joy, purpose, meaning, and I'm thinking, how? Penny's walking through Penny is walking through a really difficult time with people over and over and over and over again, and how does it produce this type of impact? So can you just explain to us what are some of the greatest impacts that this career has made on you, and why?
Well, probably the biggest one is life is short, when you're taking care of people who are younger than you. At every age I've ever been as a hospice nurse, I've had patients who were younger than me. It just really puts it in your face, like this could happen at any time to anybody. Life is really short. It goes by really fast. My age has something to do with that too, because it's like, how did I get to be this old so fast? People at the end of life just get really real, like they're really authentic. It's almost like it breaks down barriers, when you're with these people. There are no more walls anymore. It's just a very real experience. And it's just something that, I don't know, it just makes you appreciate life, that you have life. I don't know how else to explain it.
No,
I do have more joy, believe it or not. Like you mentioned, people think it must be so depressing to be with people who are dying. And it's not. I even in my book say it's fun, which some people are like, what? You said it's fun to be with people who are dying? And it's like, yeah, I've had the best experiences with patients and their families when they were faced with the end of life. Again, they're authentically themselves. There's no pretense anymore about who they are. They just are who they are. And they laugh and they joke. My favorite patients are those who make dark jokes about the fact that they're dying, because I'm all about humor. And it's just something that, I don't know, it's hard to explain, really. I'm definitely more joyful since I became a hospice nurse. I still get mad at things. Like, I don't sweat the small stuff anymore, But I always say I'll still get pissed if there's a spoon stuck in the drawer and I can't get the drawer open, yank on it a few times. But, overall, I just feel like I'm just not going to sweat the small stuff anymore because it can change so fast. I've had patients who got a diagnosis and they were dying 2 weeks later. It can really, really change fast. And so I think it's just important to appreciate life and live every day, like Tim McGraw says, like you were dying.
Yeah, all of that resonates with me in the little experience that I also have. I mean, me and Mr. Don had some hard laughs together during those days that we spent together. I mean, and like you said, the walls all come down. Like, Mr. Don was always pretty private, and he always was done up, his hair, his clothes. He had a lot of dignity and self-respect, and like during those last days together. Like, he didn't care. I'd go to the bathroom with him, I'd help him get dressed. It was like we were closer then than we had ever been in our 2.5 decades of knowing each other. That's pretty wild when you think about it. Like, all the walls went away, and we were just two humans. He was pouring into me, I was pouring into him, and we were doing this thing together.
Well, I think you just nailed it, really. Death is humbling. It's a very humbling experience for people to be dying. And when you're around that willingness to share that humility, it does impact you. Like,
big time. Like
you say, like, you're just letting it all hang out, literally and metaphorically. You're just all there keeping it real. And being around that, it just makes you feel like, wow, this is such an experience.
What about the forgiveness aspect? You mentioned that in the book.
Yeah, forgiveness comes from watching people have terminal agitation. I think that's probably the biggest thing that impacted me was being with people who were so agitated at the end of life, and we don't know really what causes it. When somebody, and just to explain, because people are like, what does it look like? Usually people who are terminally agitated, they're in this what we call transition period, right, where they're more dying than they are living. So they're not able to tell us really what's happening. They're incoherent. They might be just babbling or just not able to communicate at all, and they're trying to get out of bed. They're just really like agitated and anxious and restless. And so once we assess anything that could be causing that physically, then we usually land on, okay, if we've treated everything that we think it might have been and they're still doing it, it's probably existential. So they're concerned about their existence in one way or another. And a lot of times it goes back to unresolved issues, not having forgiven people or having forgiveness. Sometimes it might just be somebody that's young, who's not ready to die yet, or has young children. But a lot of times it comes from, just your why me, why now kind of thing. And so I think that really helped with understanding that I just needed to forgive people and to forgive myself. And that was probably the biggest thing, was to forgive myself. And also just to be able to go, who I am today is such a different person than who I was before. But all of the crap that I did, all the things that I lived through is why I am who I am today. And that's a huge part of being able to forgive myself for the things that I did.
Man. That's magnificent that you saw and understood the importance of forgiveness by way of watching the results, essentially, of unforgiveness remaining in a person's mind or spirit, or however you would describe it. Dang. Forgiveness has for me, mine was totally different. I learned about forgiveness from Don because I had abandoned our friendship for years and years. And one of the reasons I was most afraid to enter back into him enter back in with him at the end of his life was I was afraid that there was no way he was going to be able to forgive me for abandoning our friendship. And I will never forget, Penny, his wife called me, and it took me a while before I worked up the courage to even call her back. And she said, he just wants to see you one more time. And I will never forget walking in the room to see him the first time, and I just broke down in tears and asked for forgiveness. And he said, there's nothing that you need to be forgiven for.
Wow.
Come here, son. Give me a hug. I was like, whoa.
Wow.
Like just pure forgiveness from him to me. Like, that's something to strive for right there.
Yeah.
That's something to strive for. Powerful, man.
People want to know that at the end of life. There are things people want to know at the end of life. They want to know that their life had meaning and purpose, and they want to know that they've been forgiven. And it doesn't mean that everybody deserves to be forgiven or that we owe people forgiveness. And I think that's really important to address too, because
You've talked
there's
about that, yeah.
like no contact thing. A lot of people are like no contact with their family members or whatever, for whatever reason, that they're abusers basically. And so we always say you can forgive people without having to go and see them. Like, you don't have to go see somebody who was your abuser to forgive them. You can forgive them without going there. And that's okay. And we don't judge, the hospice team won't judge someone for that.
I think that's a critical point, because it would be very easy to have a sense of obligation to go and see the person. And there are some situations where that's probably not the best thing for either party, or maybe one party or the other. So that's it. Yeah, that's a really great point to bring up.
People don't change that much just because they're dying. So if somebody treated you badly in life, they're not probably going to treat you any better when they're dying.
Good word.
But the funny thing about patients like that, though, is it's so interesting, because you'll have a patient who has no family around them because they were such a jerk to their family members. Nobody wants to be with them. And yet the hospice team, for some reason, there's just something about them that endears them to us. It's almost like we have to step in and be the ones to care for them because they've driven everybody else away, and you just are able to accept that that person's a jerk, and you're going to do your job caring for them.
Wow.
It's so funny. It's really strange.
You have to, I'm sure you do realize, but I want to reiterate how special the gift is that you have, because not everybody could do that in that specific scenario that you just described. You have to have a very special gift to enter into that situation with that mindset and to maintain that level of care for that person who's driven everyone else away and who might be also treating you poorly at the same time. And because of your great love for this person and your care for this person, you can say, you know what, I'm going to serve them anyways. Like, that is powerful, man.
Well,
it's inspiring.
Here's something. I have never felt like I'm gifted because I can do that. I always felt like it's a gift that I get to do that because I learned from all of those experiences.
Yeah, that's good. I want to ask you or learn from you. What is the best, maybe what are some key points or pieces of wisdom that we can learn in terms of how we can best support people when they are at the end of life, as family members, as friends? What are how do we best support? And maybe some mistakes you've seen people make, and we've mentioned a few as we go. But I know for me, one of the things that I think meant the most to Mr. Don was me just sitting with him. But I wanted to get your input on that.
Yeah, well, we've already touched on it. Really, it goes back to being willing to talk to somebody about the fact that they're dying, letting them use you for a sounding board, letting them know that you're there to talk to them, or that they can talk to you about anything at all. I think it's important not to, something that a lot of people do when somebody says, well, I'm dying. No, don't say that. You're fine. No, no, don't listen. They shut people down right off the bat. And I think, if somebody's sharing that with you, that you need to let them talk about it. I think that's not always number one for me, is don't be afraid to talk about the fact that their life is ending. If they don't want to talk about it, that's cool, But if they do, be there for them.
Mm-hmm.
And just your presence, just sitting there and not feeling like you have to have a conversation. People get really uncomfortable sitting with somebody who's dying. It makes them so very uncomfortable because they're like, what do I say? Sometimes you don't need to say anything. You're just giving them the gift of your presence. And I think that's, that's powerful, to be able to sit and hold space with someone.
Yeah, that was one of the, when that was one of the things I saw, that exactly everything that I've witnessed lines up exactly with what you're saying in your experience. People were so hesitant. People would come in and have little small talk. Oh, the weather, this, the work's going this, and then they would just leave. And it confused me because I would sit for hours and hours, and we wouldn't say anything. Me and Mr. Don, a lot of times we wouldn't say a word to each other. But I could tell like he appreciated it so much. And I had put this pressure on myself that I've got to go in here and say the right things. And I realized really quickly that no, I don't even have to say anything. And it's crazy to think that just sitting there with the person is in some way comforting or encouraging or whatever it does for them. And I guess that's not every case, but in the case that I've experienced, that was a very, very powerful way to support Mr. Don. One of the things that I think is interesting about your content, though, is in terms of supporting the person, you are all about, giving them any request. If they want a glass of whiskey, if they want a cigarette, you are all, so talk to me about that. How have you seen that work over the course of your career?
Well, so the one that gets me the most is patients, family members who don't want them to smoke because they have a lung-related disease that's ending their life. So lung cancer, COPD. Patient is dying because they've smoked themselves to death, and the family now wants them to not smoke anymore. It's like, people know that cigarettes are going to kill them. They know that, and they chose to do it anyway because it's a strong addiction. It brought them whatever comfort and peace and joy in their life to continue to do it. Why would you take that away from them at the very end?
That's gonna
let them have a cigarette. It's not gonna, it's not gonna do anything different. As long as there's no oxygen in use, and as long as they understand that it's not gonna make their symptoms better, and they might have a little more difficulty breathing after smoking it. But I'm really about advocating for patients in whatever it is that they want or don't want at the end of life. I think it's so this is their show. They're the star of the show right now. So whatever it is that they want, we're going to try to let them have that. So want a glass of whiskey, have a glass of whiskey.
Yeah, I love that. Like you said, as long as it's within the boundaries of not creating a dangerous situation, you're all for supporting them in that way. And I could see where people would miss that, like family members, because everybody's freaking out. You know what I mean? It's like, oh, no, they can't do that. It might kill them. It's like...
Yeah. Well, that's a big one we hear with the morphine too, right? Because people just automatically think you start in the morphine, that's going to cause them to die faster, or that they're going to get addicted. That's something else people worry about, is that the person's going to become addicted on pain meds. We're like, well, we're not going to worry about that. There's not time for that, for one thing, but also those medications were created with a specific purpose to help with pain and other symptoms, and that's what we're using them for. It's not like they're trying to get high. It's not party time. We're using these drugs for their intended purpose, and we're not overdosing people. We're just giving them what they need to be comfortable at the end of life. So we do a lot of education around that.
Mm-hmm. Mm-hmm. Yeah. I mean, thank God for those drugs, because I saw them have the intended effect upon my friend when he was really suffering, like really bad, and they helped tremendously.
What was his diagnosis?
It was pancreatic cancer.
Oof, that's the worst.
Yep,
That is the
pancreatic
worst.
cancer.
Okay, I know you're the interviewer, but I have a question for you. What was it that enabled you to be able to go in there and have those deep conversations and to sit in silence when nobody else around him was able to do that?
For me personally, it was my faith in Christ, and knowing that I'm called to serve others, and then also it was my love for him, my love and appreciation for his mentorship. Yeah, I'd say those were the two major components. Have you seen patients like decide not to do any medicine? Does that happen?
Yeah. The one that comes to mind, it was her religious belief to not use any medication. And that was a tough one because she was in so much pain and wasn't willing to take any medication at all. But most people, even when they're very resistant to wanting to use the drugs, if they get to a point where the pain or whatever symptom they're having is not tolerable anymore, they will usually acquiesce. And it takes a lot of education, again, too, because there is a lot of people who are afraid to use morphine. And so once I start talking to them about, first of all, if you're, somebody who's opioid naive, you've never been on an opioid or you haven't taken very much in your life, we aren't going to be starting you on a huge dose of drugs. We're going to be starting you on a very small dose. We typically start morphine at about 0.5 milligrams, and the dose of morphine that we give people is less strong than a Percocet. And people don't seem to have issues with Percocet, but when you use the M word, then they're afraid of it. So I've had lots of patients, specifically older patients are usually the ones who are really, really more resistant to it because, morphine just goes way back in. I think they used morphine a lot in wars, right? When someone was dying, get the morphine, give them the morphine. And
still do,
just
yeah.
That association with morphine equals death. And we use it because it works fast and it's cheap.
Oh, it's an amazing drug.
Yeah, it's amazing. And it works really, really well for shortness of breath. And that's the one where people will be so short of breath, and I'll give them a little tiny dose of morphine, and it just relieves their breathing instantly. So I've had lots of patients who are like, I don't want to do it. And I'm like, let me just give you a little bit and see how it works for you. And then pretty soon they're like, yeah, this stuff is great. It works really good.
Yeah. Is there... one of my last questions on supporting friends or loved ones or people that you're with. Have you seen it in cases beneficial to maybe encourage them to maybe like just go outside or like maybe do something that you know that they loved to do, but because they're they're going through such a difficult trial, they probably don't feel like doing it. And so should we encourage them? I mean, obviously not force them, but should we encourage them maybe to do things that, have you seen that?
It depends on, like kind of where they're at in their dying process. Suggesting maybe more than encouraging.
Okay.
Distraction is good though. If somebody is someone who really liked to be out in the fresh air, sure, let's put them in a wheelchair and take them outside because distraction can be helpful when you're trying to, calm symptoms down. But definitely, I think suggestions are better than like trying to talk someone into, like, you should go outside. I think it's better than like, would you like to go outside? Do you think a little fresh air might help you feel better? I think that's better than trying to talk them into.
That's so good. Yeah, that's so good.
The same goes with food and fluids, and I don't know if you're going to get to that in your list of questions, but that's a topic that's...
No, I don't even have that, but we do need to touch on that because
Yeah.
I know that's one of the things that you talk about all the time is the food and fluid stuff. So,
Yeah.
And this is right along the lines of supporting.
Yeah, exactly.
someone.
It
Yeah.
is, because people think that hospice starves our patients to death, that we're going to not let them eat. And that's so not true. We do want people to eat whatever they want. Like I say, I'm a foodie, so I'm all about the last meal. If you want to eat something, whatever it is, we don't care. It kind of goes along with the smoking cigarettes or drinking your whiskey. If you're a diabetic, who cares about your diabetic diet? If you want ice cream, you can have ice cream. What's it going to do? Kill you? You're already dying,
Yeah.
So whatever they want. But the reality is that when people are dying, they are not going to be very hungry anymore. When the body is shutting down, one of the first things that starts to happen is they lose their appetite. Digestion is a process that consumes a lot of energy in our body, and our body is trying to systematically shut down, and it needs to conserve energy so that the vital organs can continue. So because digestion takes so much energy, the body's like, let's just slow that down and let that energy go back where it needs to be, to the heart, to the lungs, those organs that really make us function and continue this dying process. So it's important to not encourage people to eat. But if you want to eat, we'll give you what you want. But if you don't want to eat, that's okay too. Yeah, and I have a whole chapter dedicated to that because I've seen that so many times. And one of the things that happens, we just associate food with love, right?
Yep.
And
especially in the South.
Yeah, and celebrations are all about food. We celebrate with food. It's just, and feeding somebody is something anybody can do. You don't have to be a medical professional to give someone something to eat. So it's like the family sometimes feels like this is all I can do is try to encourage them to eat. Maybe they'll feel better if they eat. Associate food with wellness, you know. So that's a tough one to address because it's one of the top things that people think about is, and they are worried that the person is going to starve to death, and they're not. They're going to die from their disease. Not eating is a part of that process, and they're worried that that'll be painful, and it's not going to be painful because the body doesn't need or want that food anymore. And the same thing with fluids. People lose the ability to swallow as they get closer to the end of life, so they're not drinking as much anymore. And the families worry about dehydration. Dehydration will be painful. We need to give them IV fluids. In reality, if we put fluids into a body that's shutting down and can't circulate those fluids anymore, it causes more harm than it does good because those fluids will build up around the heart and the lungs and make it more difficult for the person to breathe.
Yeah, this is such good stuff. I hope it helps so many people because this is wouldn't be common sense stuff to people.
It goes against everything we've ever thought in our lives.
It really does. Yep. But man, this stuff is. I feel like what you are doing is you're equipping people like me. Like this knowledge is equipping me to be a better servant. Like that's what this knowledge is doing. That's why I'm so into this, man. I'm so into this. Let's take a quick break, and I want to spend some time when we come back on the woo-woo stuff.
Okay.
The strange stuff that happens that we can't explain, the stuff you've seen, and I want to talk about that and what that looks like. And not only to equip people, but I think it's fun conversation and interesting.
The best part of dying.
All right. I'm going to ask you about that. Let's take a quick break.
All right.
So my dad also has a servant heart and loves people a lot better than I do. I've learned a lot from him. He was with my grandfather through the his entire process of dying, and he could probably ask better questions than me on this interview because I'm just now getting to a point in my life where I'm learning how to love people well. All right. every human being ought to be interested in what's happening after we leave this place, right? Is one of the major questions. Why are you here? And what's going to happen after you leave? And of course, we can't definitively answer that question because we hadn't left this place. We don't know what that transition is going to be like. But I mean, you just made the statement before we started the break that this is the funnest part, I think, of dying is these strange, unexplainable things that you have witnessed when your patients are near death. And I described it as, like, in my limited experience, the veil between this realm and whatever else is out there is gets really thin.
Mm-hmm. That's exactly how I think of it too. It's exactly how I think of it. And the things that we witness when people are dying just reinforces that for me, because when they are in this period of transition, it's almost like they're here and then they're somewhere else. They kind of go back and forth. You can just sense it with people, like they're here and they're talking to us, and then they're like somewhere else. And it does feel like they're going back and forth between two worlds. And so you talked about how I said the eyes are the window to the soul. And that's kind of the story that I pretty much opened the book with, because it's the one I told on TikTok that went viral that made me realize, oh, I should be talking about this on social media. People want to know about this. I was new as a hospice nurse working in a hospice care center, and my patient had a daughter who was a nun, so she had a lot of nuns visiting her. And one evening, the last visitor left. She was a nun. She came to the nurse's station, and she said, "She's gone." And I stood up with my stethoscope, and I said, "Oh." And she said, No. Her body is still here doing the work of dying, but her spirit has left. You can see it in her eyes. And I then, being very curious, because I'm new at this, walked into the room and looked at her, and I could see exactly what that nun was talking about. Her eyes were open, but she wasn't looking at anything. I could just see her. They were glazed over, and she just had this really distant stare, like the lights are on, but nobody's home. And ever since then, and I've seen it so many times, I've always felt that, like the spirit has left. Our vessel is just continuing on the work, and the spirit it's checked out. Wherever it's gone, we don't know, but it's gone. So, and it was something that was just like, okay. So as I said, I have no religious upbringing and didn't have any belief in afterlife, and that gave me so much fear. Like, what happens after we die? Seeing that was like, maybe there really is something after this life.
Okay, a lot of my viewers are Christian, and they're probably thinking, as they listen to this podcast, why is Chad having a conversation about the afterlife with someone who doesn't believe in the Bible or Jesus? And you know what? I've considered that question because I know people are asking that. You know what I love about your testimony and your faith in the afterlife is I know that it's coming from experience of what you've seen, and it's not because you're trying to defend any certain religious belief. Do you see what I'm saying?
Yeah.
You see what I'm saying? Like, I can sit here and defend the biblical narrative of the afterlife, which I believe is accurate and true. But in a lot of cases, a unbeliever could hear me talking about that and say, well, he's just saying that because he's trying to defend his religious beliefs. And it's like, no, that's not why I'm saying it, but I could see how you could perceive it that way. Whereas when it's coming from you, you're not trying to defend any specific way of thinking or belief. You're saying, I've seen this. I don't know quite what it is, but there's something going on. And I think that's powerful, man. You know, I personally do.
Well, I think part of it for me is like, it is my experience with seeing these things and interpreting what I see, but also being able to say, I admit I don't know everything.
Mm-hmm.
And like you said, we don't know until after we're dead. You know, we really don't know. And I'm willing to say, it could be anything. I don't know, but it's something. I know what I believe it is, but I don't know. And
also you coming from really no foundational belief or teaching of an afterlife to now your perspective now based off of your experience just shows how powerful the things are that you have witnessed throughout your career. I think it's wonderful. So I'll tell me some stories or, some stories about the deathbed visions, which are something that you mentioned quite a bit, and something that I also witnessed. I remember seeing my friend Mr. Don when I would leave the room. There was a camera on him, and when I would leave the room, he would start reaching up like this, and he wouldn't do it necessarily when I was there with him, but when he was by himself, you would see him doing it. So, and so a lot of your content around these deathbed visions and the woo-woo stuff was very encouraging to me. So tell me some stories about this, impactful things that and I'm sure you've seen hundreds, but.
Oh, yeah. Yeah, well, it's my favorite story, one of my favorite stories, and it's in the book, but I was working at the care center, and the nurse's station was right next door to a patient room. And the man in the room, I'll call him John, his wife had died a year before him, and now he was here at the care center dying. And I heard him yelling, and I went into the room, and he's looking up in the corner of the room, and he's reaching up, and he's crying. He's got tears coming down his face, and he's just like, Ingrid, Ingrid. And I said, John, was Ingrid your wife? And he said, yes, yes. And I said, is she coming to get you? And he said, yes, but not today, tomorrow. And I thought, well, that's specific. And so then I went home, and I wasn't working the next day, but I was working the day after that. And I heard that he had died 2 days later, not tomorrow like he said, but 2 days later. And his caregiver, who had cared for his wife also, came in to get all of his belongings. And I told her the story. I was just fascinated by this story that he had said she was coming tomorrow, but she didn't come for 2 days. And without skipping a beat, she said, it was always like Ingrid to be late.
No kidding.
Yeah. Yeah, that was my favorite. So many. One thing that was fascinating to me was a patient that I had who started talking about seeing a baby. And her sister was there and her adult daughters were there, and they were just puzzled, like, who's this baby she's talking about, a baby girl? And her sister said she had a baby when she was a teenager and it didn't survive. And her daughters never knew about it. So she was like confessing a family secret on her deathbed by talking about this baby that she was seeing.
And when you see these things happening, or you're with someone and this is happening, I think the initial response would be to try to talk them out of what they're seeing. And you don't do that.
No. And family members will be worried, I've had family members who called me in and said, he's hallucinating. Can you get him something? I think he needs medication. He's hallucinating. And I will watch for a moment and see what's going on. People can have hallucinations at the end of life. They can. That's usually going to be something that's either causing them fear or anxiety, or just something bizarre and off the wall, like a polka dotted elephant in the room, right? Yep. Deathbed visions are something completely different. We do not consider a deathbed vision a hallucination. Hallucinations are typically caused by either disease progression, especially if there's any kind of brain involvement, or medication. So we are going to try to treat hallucinations. We're going to try to take the drugs away that are causing them or give them a medication to stop them. Deathbed visions, we don't medicate away because that is something that brings comfort to the person. So usually we are just going to explain to the family, this is normal. We see this all the time. It's bringing them comfort. We don't want to do anything to try to stop this because it's something that they are comforted by. Mm-hmm. And once we explain that, then they're usually fine with it. They're okay with it. At first, though, people can be like, what? He's talking to my dead grandma. Is something wrong? But then it goes back to normalizing that for them, to saying, no, this is normal. We see this. And we don't want to medicate it away. There's no need to. It's not caused by the drugs. And that's another thing. People will, so I've got this whole woo-woo chapter about DMT, this naturally occurring substance in plants and animals that can cause hallucinations. So whenever I do a video on deathbed visions, people will jump in the comments with, it's just DMT, it's the drugs, it's
releasing.
It's
I've
DMT
heard those,
releasing. Yeah. And so first, it's not the drugs and it's not their disease, because this can happen with people who have no brain involvement, no medication that can cause this. And we call it a deathbed vision, but people aren't necessarily on their deathbed when it's happening. They can have them weeks before their death. They can be very coherent, like that gentleman I told you about. I've had lots of patients who just told me, yeah, my dad's over there in the kitchen, or I just saw, and sometimes they come to him in a dream, but they're coherent. Like there's no indication that this is caused by something. This is just a vision that they're having. So I can rule that out easily by saying no. But the DMT thing had me really intrigued when people would say it's DMT. So I started researching it, and I found out that they had done some studies on rats, and they were inducing heart attacks in rats. And when they did, a small amount of DMT was excreted from their brain. So then I researched it more and found out that DMT is naturally occurring in plants, and that indigenous peoples used to use these plants, and some still do, like ayahuasca. Yeah. People will do to connect with the spiritual world, to communicate with their deceased ancestors. And I thought, okay, so the presence of DMT and deathbed visions being real spirits are not mutually exclusive. Maybe it's the DMT that allows a dying person to communicate with those spirits of their deceased loved ones.
Mm-hmm. So is that DMT naturally occurring in the brain, and is it proven that it does?
They haven't been able to do studies on humans. They've done it only on rats.
Okay.
Yeah, because when, we don't do a lot of. This is why there are things about the dying process that go unexplained, like the deathbed, the rally, the end of life rally, where people all of a sudden they're dying one day and then they're sitting up and they're wanting to play parcheesi with their neighbor. That happens,
tell me about that.
Yeah, that happens in about 4 out of 10 dying people, where they're dying. They look like they're down for the count. Sometimes they could be unresponsive even. And all of a sudden they have a great day. They're awake. They want to visit. They want to eat. They might have a meal. And it lasts about 24 hours or less. And then they go back to dying, and they usually die within about a week. And we don't know why it happens. Just a little window of opportunity to say goodbye, but there's no explanation. And we don't know because we don't do studies on people who are dying to satiate our curiosity. It's just like, we don't really need to know why it happens.
Yeah.
You don't have to explain everything.
Yeah. We've had that conversation. The DMT stuff is very prevalent in the veteran community now, and it's being used more and more as a treatment for PTSD, and a lot of veterans have great testimonies about it. And we've had that discussion many times on the podcast of what's going on here with, like you said, when you're using it intentionally, not when it's released in the brain naturally through the dying process, if that's actually happening. But like, this substance seems to some way be unlocking the brain's ability to see into another realm. Mm-hmm. The biblical narrative would say that the human, when we were created in the beginning, the brain had the ability, the human brain was created with the ability to see into that other realm at all times. As man was walking in union with God in the garden, they could perceive God and have conversations with him. But then in the fall of man, the human lost the capability to actually see into that realm. But the part of the brain is still there existing. It's just not activated. And maybe this substance is actually in some way reactivating that portion of the human brain that we were created to have, to be able to perceive the next realm. And it's to me an intriguing conversation, and not anti-biblical narrative. I mean, it seems to fit right in the alignment with that.
Yeah, it is intriguing. We know that we don't use our whole brain. We know that for a fact, that there's part of our brain we don't use. So let me tell you a really interesting story. It's not in my book. It's such an interesting story because I have this, like I say, this idea that people are going back and forth between here and whatever during that transitioning phase. And I think they're sometimes going through life review also during that time. I had a patient who had been admitted on a Thursday, and in hospice, most hospice agencies, there's an admit nurse and then there's a case manager. So the admit nurse does the admit, then the case manager takes over. She had been admitted, and I was working she was admitted on a Friday. I happened to be working that weekend, so I was assigned to go see her. And so on Saturday, I went to see her, and she had her adult daughter was taking care of her. And she was still in her hospital gown. She had just come home from the hospital. The ambulance had dropped her off, and she was transitioning. And I was like, whoa, okay, so there's a lot of stuff I need to teach you right now. I had to put a catheter in her, I had to get her cleaned up, get her changed out of her night hospital gown, do a bunch of education with the daughter. So I spent a lot of time with the daughter, and we just really meshed, and it was really good, and the patient was really sweet. Then I saw her on Sunday, too, and she had even changed more on Sunday. Like, I knew she was not going to live very long. So on Monday, I was off, and then I learned that she had died on Monday. On Tuesday, the daughter called me, and she said, I really need to tell you what happened. Because I had gone through the whole, like, we expect these things to happen, and that included deathbed visioning. She said, Mom was in the hospital bed, and she was holding her hands up, and she said there were windows and that she could see pieces of her life in these windows. And then she said, she held her hands out and she said, am I going to need these? And her daughter said, I don't know, Mom. And then she said, and then she started to stroke her chest and she said, am I going to need this? And her daughter said, your gown? And she said, no, this. And she was indicating her body.
Her body.
And her daughter said, I don't know, Mom. And then that night she died. And I was just like, whoa, that was the most
Holy smokes.
Craziest story I ever heard. And like, wow. I thought, my God, she was like, do you need your body? Like she was seeing things. She was seeing her life. And it was just the best story ever.
That's powerful, man. Have you ever witnessed these visions being negative or causing fear in the person? Or have they always been seeming to be a more comforting presence to them? Like,
it's always more comforting. I've never seen anything that was negative or fear-causing, but sometimes people are questioning, and they're not afraid, but they're curious about it. You know, like I had, she wasn't a patient of mine, but she was a 25-year-old cancer patient who was on social media. And I met her through social media, and then I, along with another hospice nurse, did a bunch of fundraising for her memorial. And she happened to live in Spokane, and I was living in Eastern Washington, so it's about a 3-hour drive to Spokane. So we got to know each other through TikTok. And then I went to see her in Spokane, and she told me that she had been seeing a cat that she didn't recognize, but she saw a cat, and that she was seeing dark figures, and that they were starting to become more and more, like she was starting to be able to recognize them more and more as human forms. And so she never felt afraid. It never made her feel afraid, but she was wondering, like, what is this? But I've never had anybody who expressed fear.
That's good news.
Yeah. I did have the one lady who I talk about in the book, who she's so cute. She had a lung disease. I think she had lung cancer, and she'd always want to sit at the kitchen table with me. She was just not wanting people to know how she was progressing towards the end of her life, so she'd always get up with her long oxygen tube and come and sit at the kitchen table. But I knew that things were changing, and I will ask people questions so I can kind of gauge where they're at in their dying process, so I know, and so I can communicate that to the family who always wants to know when's it going to happen. And I said to her, I asked her, have you been seeing anything unusual lately? And she said, no, like what? And I said, oh, like maybe people who have died before. Oh, no, nothing like that. And I said, oh, okay. Because if you did, that's really normal. We see that all the time. She said, that's normal? And I go, yeah. People do tend to see people who have died before them. And she goes, well, my dad's standing in the kitchen. And she was, like 80 years old, so I knew. I didn't even have to turn my head and look. I knew he wasn't there. And she said, I didn't want to tell you because I thought you'd think I was crazy.
Wow.
So they're not afraid of what they're seeing, but they're afraid that if they talk about it, people are going to be
almost embarrassed. Yeah.
Questioning them or doubting them or thinking that they're losing their mind and hallucinating.
And if you had to put a percentage on this, I know this probably doesn't happen in every scenario that you have been exposed to, but I mean, how often or how prevalent is this?
It is prevalent. I couldn't put a percentage on it, but it is prevalent enough that it's in our literature as a sign that a person is approaching the end of their life. It's written into our books. Medicare governs hospice. The Medicare hospice benefit is what all the rules are. The regulations are developed by Medicare. No matter who your insurance payer is, hospice has to follow the same guidelines that Medicare has set forth for us. They set up the rules. And they have strict rules about quality reporting. They really want people to receive quality care at the end of life. And so they have quality programs. Quality, you have to have it's called QAPI. It's a quality assessment performance improvement program. Every hospice has to have one. So when I went away from patient care, I went into quality, and I was a quality specialist RN. And one of the quality metrics that they have is how many visits a person receives at the end of their life in the last 3 days of life by a nurse and a social worker. So this is something that hospices have to try to meet. Like, they want you to do at least 2 out of 3 days. So there's 3 days at the end of life. They want at least 2 visits at the end by a nurse and a social worker, like 1 from the social worker, 2 from the nurse, I think it is. I can't remember what it is now. But so we're trying to, of course, death is unpredictable, but we're trying to figure out how can we guide our clinicians to know that when a person's getting close to the end of their life, they need to step up their visits and they need to go more often. Not just because it's the quality metric, but because it's the right thing to do, because we need to provide more support. Things can change fast. So we had to come up with a guideline for people, for our clinicians, to be able to determine when somebody looks like they're within the last week of their life. And we wrote a list of symptoms down, physical symptoms, and also these other things that we can't explain. And one of them is deathbed visions. Is the person starting to vision people that have people or pets, because people see pets too.
That's good news.
Yeah, right?
That's real good news.
I know a lot of people
us,
are really comforted by that. They're like, I love
That's
my
pretty
dog.
cool.
I want to see my dog.
Yeah.
So that is one of the things that we look at as a person's getting close to the end of their life because they're seeing these visions. It is very, very common. And not everybody will tell us about them. Again, they might be afraid they're going to be viewed as Looney Tunes.
For sure.
Or sometimes they just aren't maybe having them during that period of time where they can tell us what's going on. And that's where the reach comes in. We see the reaching. And for years and years, I never put two and two together. And then somebody said to me, it's almost like they're trying to hug someone. And then I realized, oh, the reach. Most of the time when people are having deathbed visions, they're up above or to the corner of the room. So when people are doing this reach, I think they're reaching out for those visions that they're having.
Yeah, and I'm so thankful I got to witness that, and your content making me understand what was happening. Like that's so encouraging to me. Like as a man of faith, like it's so encouraging to me. Like, I mean, it strengthens my faith. Like all the things you're saying right now, like just is so. Man, I just appreciate you being so open about that stuff and so interested in exploring it and having conversation around it. And I'm going to ask you a question. This isn't a question to bait you into any, side or the other, but have you seen throughout all, your years of serving people, have you seen that faith has made a difference for people during the dying process? Or is that not really something that has stood out to you through your career?
I have seen, first of all, faith doesn't play into deathbed visions at all because atheists can have them. Anybody can have them. I have seen people who were at peace with dying because they had faith, and I've seen people who had no faith who had peace with dying, and I've seen people who had faith who had a hard time accepting, and I've seen people who had no faith have a hard time accepting. I've seen an atheist who was afraid to die, and I've seen a Christian who was wondering why God had forsaken her and why she was still living in her 90s, and it was, as a matter of fact, it was my husband's great aunt who happened to end up at the care center that I worked at. And she probably to date still, 15, 16 years later, had the longest length of stay in that care center than anybody. She had a heart condition, and we thought she was going to die right away. And then she got better, and then she kept getting better, get worse, get better. For 18 months, she was at the hospice care center. Which brings me to side note. If a person doesn't die in 6 months, we don't kick them off of service. I think that's important for people to know. But she was like, "Oh Lord, why have you forsaken me?" And she was a devoted Christian, you know. So it doesn't seem to matter really at the end.
That's interesting.
I've never had a patient who told me they saw Jesus at the end of life, but I know there are other hospice professionals who have said they have experienced that with people. I've heard of other people saying they had patients that told them they saw heaven. I had never had a patient that told me that. So it doesn't really seem to make a difference.
Yeah, that's interesting. Do you talked about? I think you said it was your great aunt. Is that right?
My husband's great aunt.
Your husband's great aunt. So that kind of ties into a question that I had. Do you think that we have some control over dying? Because I'm looking at it from Jesus on the cross, and when you read that narrative, he's Jesus, he's not me, but he's able to intentionally, it's the old school language, give up his ghost, or essentially like, okay, I'm going to die now. Do you think that we have some mental control over like clinging to life or getting to a place where we're like, okay, we're going to let this happen?
I'm glad you asked me that question. So I heard once somebody say that there's two sides to dying. There's the spiritual or emotional side, and there's the physical side, and both have to meet before death can occur. So sometimes people are physically ready and they're lingering, like my husband's great aunt, she was spiritually ready, but her physical body wasn't there yet.
Okay.
And sometimes their physical body is ready, but spiritually they're not ready to go. A lot of times that's when we see that terminal agitation. So that needs to happen before death can happen. But to answer your question, yeah, I do think people do have some ability to control when they die. And we see that when people are waiting for somebody to arrive or waiting for some event before they die, or when people are, and this is more common, waiting for people to leave, waiting for people to exit the room. And I've had so many people who tell me, I sat with my dad for 24 hours. I did not leave the bedside. I got up and left the room to go to the bathroom, and he died while I was gone. Or I tried so hard to get there. I drove as fast as I could, and I arrived, and he was gone. And it's like, okay, this is what I think about this. We know that people wait sometimes for people to arrive, or they wait for people to leave. If they need you to be there when they take their last breath, they will wait for you to get there. And I know this because I have seen patients who had a room full of family members, and that person was like, you just kept looking at them thinking their next exhale is going to be their last exhale, and yet they just keep right on going. And the family finally goes, you know what, we're just going to go out and get some breakfast. And the moment the door shuts behind the last person that left the building, they die. It's uncanny. It happens so often that people will just linger and linger and linger, and then finally everybody leaves the room, and then they'll die.
Isn't that wild?
It's crazy. It really literally is like they have control. It's so crazy. And we had this one guy, I don't know if I told this story in my book or not, but he was, his visitor was his nephew. And the nephew said that our patient, had been like a dad to him. And he said, I will be with him until he takes his final breath. I am not leaving this bedside. And it was true. He was there day after day after day. And we had soup and cookies we would bring to him from the kitchen. And he stayed there by his side. And we were just like, this guy is never going to die. And so we finally said, we don't think it's going to be that soon. You could probably go get something to eat. And so he left to go to the restaurant. And as soon as he left, our patient died. So when he came back, one of us, my nurse that I was working with, she went in there with her stethoscope. And I saw him coming through the door, and I grabbed him and I took him down the hallway, and I said, he's dying right now. He's taking his last breaths right now. And I brought him in the room, and Maggie was getting her stethoscope out, and we told him that he was taking his last breaths and that he had made it back in time to be with him, which was, I call it, what did I say? It was lying for compassion.
Yeah.
It's funny how many people got in my comment section when I told that story and said I was a horrible person for lying to him. Like, what if he sees this video and he's going to know you lied to him? Like,
Penny, I so wish you would stop reading comments. I know you can't do it, but I so wish you would stop that, because your hair is beautiful. You are beautiful. Your heart, your spirit is beautiful. Like, oh man, it ticks me off when I see some of the comments.
Sometimes it's just sometimes it's an opportunity to provide education, and sometimes it's an opportunity just to be sarcastic and say, I don't take it.
You catch some heat for sure. I catch some heat too. I can relate to you on that. But I mean, that's just so intriguing to me, and hearing your stories about that. I've always wondered this, because again, when I read, I read the narrative of Christ on the cross, and he says, it is finished, and he breathes his last, and it gives you the sense that we do in some way have some control over the release of our spirit. And to hear those stories is just amazing to me. And I think another reason it's amazing to me is because of all of my journeys in SEAL training and ultra running, and all of my experiences. I've come to have maybe a little deeper understanding than the average person about the power of the mind and how much control we have, or influence we have, just through the power of our mind. It's kind of unexplainable, but
Yeah. So another thing I want to talk about, since you brought that up too, is, and you know this because you were with your friend when he died, most people don't just suddenly have an epiphany and they say profound last words and then they die. It doesn't usually happen like that. It can happen. Actually, my dad did that.
really,
But rarely do people just suddenly die. They usually go through this dying process where they become less and less responsive, and then they're unresponsive, and then they die. That's how most people die. So like if you're waiting for last words, you need to write down everything they're saying as they're going through this transitioning process, because you're not always going to know when they're going to say those last words. But yeah, my dad was one that told the nurse he was about ready to hang it up. My dad was from the South, by the way. He's from Texas.
Navy guy too.
Yeah, he was.
Yep.
Yes. And he said to the nurse, "I'm about ready to hang it up." And then he died.
Wow.
Yeah, he was ready. When people are super ready, that's usually when they go fast.
Yeah, you talk about writing stuff down. We didn't even think about that during the time period when we were talking about how can we care for people well. That was something I missed, that opportunity with my friend Mr. Don, because it was an idea that I had, but I didn't want it to be weird with the family and this and that, because I wasn't his. He considered me family, but I wasn't part of his family, and I missed that opportunity because I had that. I wanted to give Mr. Dunn the opportunity to. He only had like a 6th grade education, so he couldn't read and write very well, if at all. And I wanted to give him the opportunity to speak to me and allow me to write whatever it is he wanted to say, or maybe leave to. And it would have been fine if he would have said no. But I waited too long. Yeah, I did. And who knows what he would have said, but I don't know. I think that would be cool if somebody maybe offered me that opportunity when I was in that situation.
Well, you could start writing now.
I know. Well, your book is like, just reading through your book and the way that you wrote it is inspiring to me, because I do want to write a book about my experiences and just the wisdom I've been given throughout the course of my life. Not that I love in your book, you said, I have wisdom. You didn't say you're wise. You said, I have wisdom to share. And I feel the same way about myself. Like, I have wisdom to share. I'm by no means consider myself wise, nor do I have it all figured out, but I do have some wisdom through my experiences in life. And, so many books now are written, the person tells the story and somebody else writes it. And look, I get that. Not everybody has the gift of writing, but I'm a reader, and it comes through when you read the book and you have some idea of who the person is that's supposed to be the author. You can kind of tell whether they wrote it or not. And I need to take it upon myself to sit down and do some writing. That's a good thought.
One of the reasons why I wrote it like that, and why I have shared so much about my life that most people are going to be not wanting to talk about themselves, is because I feel like, anybody can pretend there's somebody on the internet, and I thought I silenced that.
It's all good. Just a little distraction. It's actually a great ringtone. We're not going to edit this out, by the way.
Oh, really?
Oh, heck no. We keep it real.
Okay, so the reason why I have shared as much as I have about myself on my social media and in my book is because, people can be on the internet and they can pretend they're anybody. And we see that sometimes when people are exposed for being somebody who they are not. We all think they're this person, and then it comes out that they're really not that person. They're somebody much worse or whatever. I'm talking about something that is, not only am I so passionate about it, but it's such a difficult topic for people to learn about. It can be sad, it can be scary, and I want people to trust me when I say, you should not fear this thing. You should embrace this, because you will have a better death experience, whether it's your own or someone who you love, if you are able to understand what's going on and know it's normal. I want people to trust me. And I felt like the best way to get people to believe me when I tell them this is the truth is to share things about myself to let them know that I am authentically who I say I am.
Yep. Sometimes that takes time to be able to do that. But that really resonates with me. Well, we're going to wrap it up soon, but another thing that I just, we kind of started off the conversation talking a little bit about how much I think both of us desire unity in our country. And I think we would be remiss if we didn't say this subject today is a thing that we can all find unity in. And I truly believe if we as individuals considered the fact that we will all share in this experience of dying, and that if we could hold the perspective that you've been able to gain by way of your career and your chosen way of life and being with people, if we could in some way just grasp at maintaining the perspective that, man, our days are short here. This experience is unifying all of humanity. I think that would be a good step in the right direction. And contemplating, I do, for me personally, I no longer run from contemplating my own death. As a matter of fact, it's something that I will spend maybe a few minutes a day contemplating in a healthy way. Would you encourage people? I mean, I assume you would. And,
yeah,
absolutely. It's even a thing in monasteries. There are images of monks who are holding human skulls, and they're looking at that skull, and what they're doing is remembering, this is me.
Yeah. Well, yeah, so to touch on your first point there, death is the great equalizer.
Yes.
None of us gets out of here alive. At the end, I've cared for people, like I said, who were homeless, and I've cared for famous people, but they all died the same. They exhaled one last time, and then it was over. It's going to happen to every single one of us. But I absolutely encourage people to think about their own death. I think, one of the things I say about getting over death anxiety, so a good part of my base who follows me on social media follows me because of their fear of death. And I always say, watch my content, read my book. If you're afraid of death, then the best way to get over that is to learn about it, to get in the conversation. Don't be afraid to talk about it. The more that we acknowledge that it's going to happen to us, the more that we can take the power away. We can just be like, yeah, it's going to happen. Now I can live my life because I've got no control over that. I don't know when that's going to happen to me. And if I perseverate on that too much, it inhibits my ability to have joy. If I'm thinking about this all the time, how can I be happy if I'm always thinking about it? Doesn't matter anyway, because I'm just going to die, you know? So I just don't think about it anymore in terms of worrying, right?
Yep.
I think about it all the time, obviously. I'm obsessed with death, but I don't worry about it anymore. Yep. And if you are, some of the things that you can do to ease yourself into that is what I call legacy work. So when my girls were teenagers, we'd be in the car listening to music, and I would say, "Oh, that song right there, when I'm dying, I want you to be playing that song for me. That's my favorite song." And of course, they were like, "Oh, Mom." But, you know, how about writing little notes about certain things that I have that I want my daughters to know where this jewelry came from, or, you know, my son to know, you know, what that meant to me.
Yeah.
You know, where did I get this? That type of thing,
Yeah.
legacy work, like going through pictures and deciding, like, do you really want this picture to be something that people are going to see after you die and remember you by, or, you know?
Oh man, yeah. And that legacy work too, I think could be so important to help. You said earlier, one of the main things people are worried about when they're going through this dying process is their loved ones who are going to be left behind, who are going to be still living. And this legacy work can actually help alleviate that. I just heard a story. I got to share this story with you. Have you ever heard of Duck Dynasty?
Oh yeah,
The TV show. So I was just down.
I thought you were on that.
No, I wasn't on the show, but I was just down duck hunting with those guys this past weekend in Arkansas. And they told, Phil Robertson, the main character of the show, the leader of the whole family there, he recently died. And Jay, his son-in-law, was telling me Phil left a note in their little duck hunting ATV thing. And they found it after Phil died, and the note said, "Don't cry for me, I made it."
Oh.
And now they have it pinned in their duck hunting lodge. And it's like, I was like, whoa, man. So that was Phil doing that legacy work, thinking ahead and saying, I'm going to write this little note, stick it in this duck hunting rig, and these guys are going to find it at some point, and it's going to be comforting to them.
Wow, that's amazing.
Yeah.
Yeah.
Goes right along with what you're talking about.
Yeah, that's amazing. That is the type of thing, exactly.
And I think, for our Christian audience too, the scriptures have a lot to say about death. You can learn a lot about death if you will not avoid searching it out in the scriptures. It has a lot of stuff in there in detail about death and dying, and man, it's in there. And I think if you are a Christian, it goes to show that this isn't something that the Lord wants you to just avoid or shove off. Or, man, the Lord has left us comforting words of encouragement and guidance in the scriptures, that get into those, man, and read them, and get Penny's book and read it from her perspective. And I love it. I think this is such a valuable conversation. And what's next for you, Penny? Are you retired from nursing now?
I am retired, yeah. I'm
Okay.
retired. I retired last June. So mostly to work on my social media, but also because I'm old and life is short and I want to live it.
And you're doing it too. I see you with the chickens, and you are living an awesome life, it looks like, out there.
Yeah. So my podcast partner, Hallie, she's a social worker, hospice social worker. She and I are in the process of writing a new book that should be out, I think, spring of 2027. And just continuing to educate on social media. Death is my jam. I love educating people. So I'm on TikTok, Instagram, YouTube, Facebook.
You just hit 1 million.
I just hit 1 million on Facebook,
right?
Yeah.
That's solid.
That was pretty sweet. Yeah. I got 1 million on TikTok this year too.
No kidding.
Actually, it was December, I think. I finally got 1 million on TikTok. So, yeah.
You enjoy the content creation?
I love it.
Yeah.
Yeah. Yeah, I love it. I have always been a little bit of a, performer.
Yeah.
I did stage plays and sang in a rock band, and I've just always liked to put myself out there. And so when I discovered TikTok, I wasn't doing death videos at first. I was doing shuffle dancing. But I was 57 years old on a kids app, so that didn't go anywhere. But I found my niche with the death content, and I love it. I love it.
Do you do any public speaking?
I do, yeah. I've
Okay.
done some keynote speeches, yeah.
And because I just, listening to everything that you have to share, like, I think the wisdom that you have to offer is not only intriguing, but I think it can be important, an important reminder or perspective shift, even for professionals in the corporate world. Like they need a lot of this stuff. Everybody needs to hear it, but especially them. You can get caught up so much in the hustle and bustle, and it's like them hearing from somebody like you at one of their yearly conferences or something like that. It would be a wonderful reset for that group. And so I was wondering if you were doing that. And do you have a website or?
I do, yeah. It's hospicenursepenny.com.
Okay. So all the speaking and everything's through that.
Mm-hmm.
Amazing.
Yeah.
Did we miss anything?
And lots of resources too on my website. Lots of links to resources, and I have an interview guide on there for how to interview a hospice if you're looking at wanting to go on hospice or have a family member that wants to go on hospice. There are lots of things about hospice people get wrong, like the whole kick them off at 6 months thing, not true.
Mm-hmm.
And that people have a choice of what hospice they go with. If there's more than one in your area, you do not have to go with the one that a hospital refers you to. You can choose your own hospice. So there's an interview guide in there on what questions to ask a hospice if you're looking into that.
That's amazing. What a great resource. Did we miss anything?
I don't think so.
Okay.
I think we covered it all.
I got all my questions in,
Great.
and you answered them so well. I wish there was more that I could do for you for giving me this opportunity to ask my questions. And this interview was so much for me because, well, there's not many people I get excited about meeting, but I think because you had such an impact on me at such a key point in my life, like I was really excited about meeting you and really excited about being able to ask these questions and equip myself as if the Lord allows me to keep living, people around me are getting older, and I want to be equipped to love them and support them and help them in whatever's coming. It means so much.
I love that. It's about
Thank
the
you,
journey,
Penny.
right?
It is. Thank you.
Mm-hmm. Thank you.
All right, guys, go. Penny's not hard to find. Go find her, follow her, check her book out, and shoot her a message. And if you got something out of this, thank her for the work that she's doing and for the conversation that she so generously offered up and her time that she so generously gave us today. Love you guys. Enough said.